So this particular multi-center phase 2 study, we evaluated a group of patients with pre-fibrotic primary myelofibrosis as well as DIPSS, low and intermediate-1 risk myelofibrosis. The key thing about this population is there's no specific approved therapy, with the exception of patients with mesosplenomegaly who might benefit from JAK inhibitors. And obviously, in most of the MF studies, the key primary endpoints were actually based on spleen sizes, were actually based on their symptom reduction, but none of these studies actually had outcomes that were based on disease modifications. Right? But we know that with recent studies and upcoming compounds with higher chances of disease modifications, that might change. So in our study, the primary endpoints was the safety and efficacy, and there were key secondary endpoints that included molecular responses. Right? So I'm presenting the analysis of 65 patients. The study is still ongoing, with multiple sites in Asia being participating. And with these 65 patients, we have a median follow-up time of around 15 months. And we actually observed at 12 and 24 weeks, around 80% of patients would have complete hematologic responses, i.e. with adequate control of the hemoglobin, white count, and the platelet count. And these responses actually improve with time. You can see these responses improving from 12 to 24 weeks to 48 weeks. And one of the key things is we also noted that this compound was safe. You may note that the dosing is actually different from the approved dosing in the EU or in Europe. For Ropeginterferon alfa-2b, in this study, we actually use it at 250 microgram at week 0. At week 2, it will be 350 microgram, followed by a 500 microgram at week 4. And it will be given every 2 weeks. We found that this regimen is actually quite tolerable, with less than 10% of patients having grade 3 or 4 toxicities that require dosage reductions. So as far as toxicity is concerned, most of the toxicities were grade 1 to 2. Right? The commonest hematologic toxicity was anemia, and that's somewhat expected, especially with a group of patients with myelofibrosis. And but then less than 10% of these patients had grade 3-4 that required dosage modifications or reductions. The commonest non-hematologic toxicity was actually hair loss, which is more common in women, mostly grade 1 to 2, didn't lead to any discontinuations. So overall, there were no safety signals, no deaths or vascular events during the treatment, and there were no disease progression to accelerated phase or blast phase myelofibrosis. And one of the key secondary endpoints that I mentioned was the molecular responses. We actually observed that at 12 weeks, more than 50% of our patients had reductions in their JAK2 mutant allele frequencies by droplet digital PCR. That was also observed with keratocyte mutations. And at 6 months and 12 months, we observed that these molecular responses actually improved further on. We even had a couple of cases with JAK2 positive myelofibrosis having complete molecular remission based on our droplet digital PCR platform. And that actually gives us a signal that this is a potentially disease-modifying treatment in this population of patients. And as far as bone marrow morphologic response is concerned, we actually observed 20% of our patients at 6 months or beyond having reduction in the marrow fibrosis or improvement in the megakaryocytic morphology. So that's the summary of this study.